I have suffered from gastroesophageal reflux disease for 2 decades.
Gastroesophageal reflux disease is a disease of the lower esophagus where it doesn't form a barrier to the acid from the stomach. And so acid goes up the esophagus and causes symptoms for patients such as heartburn or regurgitation.
Every time I ate, I was constantly regurgitating. There was no closure to the esophagus, so it just would always come right back up and flow back and forth and back and forth. I first started taking acid suppression medication on a daily basis about 21 years ago. Graduated after a few years to the H2 blockers, and I went through them all.
Finally, he was combining 2 or 3 medications, and still he had many breakthrough symptoms. And so he came to seek another solution. The LINX device is an elegant device that is a ring of titanium beads that we place around the lower esophagus. And these beads have a magnetic core, and they sit around the lower esophagus, and when you eat, the beads open and allow food to go into the stomach, but then they close and keep acid and bile and food from coming up the esophagus. Well, what's exciting about this procedure is that the patient can come and they stay either one night in the hospital or sometimes can go home the same day. It's a laparoscopic procedure, so it's minimally invasive. You use very small incisions on the abdomen, and it's about an hour-long procedure. And the great thing is the patient can start a normal diet just the next day.
She's methodical and she wants the best for the patient. So she's quite an impressive doctor, certainly an impressive surgeon.
Brad's doing great. I mean, he was very excited, and I know within a few days after his surgery, he started eating meals that he had only wished he could eat before. And he said his symptoms have totally resolved, and he's very excited about the procedure and the results he's had.
It's a little bit astounding because I've been taking something for this for 20 years, and I simply don't need it anymore.